type of work that I do is primarily looking at mental health and mental health in the schools. And so I do a lot of work on cognitive therapy with children, mindfulness work with children, and Steve and I have been colleagues for many years, and he does a lot of work in working with trauma-informed practice in the schools. And one day he was in his office and I was in mine, and we realized that much of the work that we were doing would fold really nicely together. And so we started developing some workshops and some education around what happens when there is a crisis event in the school, and then moving forward how the school-based mental health professional could move in and intervene with that type of trauma or crisis.
Yeah, the work that we're doing really kind of evolves or can be considered part of the trauma-informed movement. Oftentimes you hear people talk about trauma-informed schools. Essentially what that involves is creating a school environment wherein all of the educators are appreciate the sometimes profound impact of chronic trauma exposure. As Melissa was indicating, there are some very measurable, real, physical impacts of trauma exposure, in particular with neurobiology. So in the classroom, what you sometimes get for the kiddo who's constantly exposed to trauma. A classic example would be the child who's an abuse victim. So the kid who's constantly being abused at their home. What we're going to find neurobiologically is certain brain regions like the amygdala, which is the brain's fear centers, become more active. Why? Because it's actually adaptive at home. In the abusive or the threatening or the traumatic environment, constantly scanning the horizon for the next threat to your physical integrity, it can keep you alive. So in that setting, it's adaptive. But then you get that kid coming to school. That kid comes to school, and now, maybe the teacher speaks to the student sternly. Well, they're going to react. And if you're in a dangerous, threatening environment, being able to react without really thinking too much about it is a good thing. But in a more normative interpersonal environment, like say a classroom, reacting to a teacher saying something that you misinterpreted as potentially being threatening. For example, the teacher saying firmly, "Stephen, sit down now," which, gets your attention, but there's nothing threatening about that. The kid who's a complex trauma victim or has something like PTSD might misinterpret that, and the student may act out physically. They might freeze, they might fight, which could get them in all sorts of trouble, fighting with a teacher, or they might flee. That's also going to get you in all sorts of trouble. So our work is designed kind of to help educators, help our colleagues appreciate the impacts of that. But more than that, especially in collaboration with Melissa, we are in our workshops right now very deliberate about training educators in some practices that the literature has documented as being very effective in terms of remediating some of these adverse neurobiological differences that complex trauma exposure can generate.
Absolutely. And also interpreting the child's behavior appropriately. And so instead of when the child, as Steve mentioned a minute ago, has that exaggerated startle response and does fight or flee the situation, the teacher, educator, or school psychologist, school counselor would have more information about trauma-informed care to where they would interpret that behavior accurately. And so we oftentimes say in our workshops, instead of asking the child, "Why did you do that?" instead to ask, what's happening to you? To be curious about what would evoke such a response when simply the child was told to sit down. So to have that behavioral context, and then other ways of intervening. When that startle response happens, what happens is the child moves into that sympathetic nervous system, and they go into that fight, flight, or freeze. And with some basic mindfulness techniques, through some grounding exercises, some deep breathing, we can bring the child back down to a baseline resting state, to where then those regions of the brain that had gone offline when they were startled can come back online to where they can have more effective decision-making, planning, and also memory.